Welcome everybody, we are ready.
Yes. Are we live already?
Yep.
Okay, so we can start. Hello everyone. I, Samina Khan, as the moderator of this session, welcome you all to the MD International Mental Health Series. And we would like to take this opportunity to acknowledge the traditional territories of the people of the Treaty 7 region in southern Alberta, which includes the Blackfoot Confederacy, Siksika, Piikani, and Kenai First Nations, as well as the Tutena First Nations, and the Stoney Nakoda, including the Chiniki, Bearspaw, and Wellesley First Nations. The city of Calgary is also home to Métis Nations of Alberta Region 3. I would also like to mention this, that all the opinions which are going to be expressed in these sessions during the series of all these seminars, they are of the speakers. MD International is not bound to the opinions of the speakers. Every physician is responsible for the authenticity of the information and limits to copyright for the material presented. Now, I would also like to go through certain important points before introducing our speakers for tonight. These sessions, they will be recorded and available on Facebook and YouTube for limited time period. So those of you who are going to miss it, they can watch it later on. I would also like to thank everyone who have submitted their questions. We will try our best to answer maximum of those, not only in today's session, but also in the upcoming sessions. If time permits, we will open the floor for the live questions. And when we open the floor for the live questions, you can raise your hands and ask the question, or you can even type in your questions. For typing, I would suggest you use the Q&A box. If you look down, there is a bar and there is a Q&A sessions. So please type in question in there, not in the chat box, because it's very easy to lose the track of the questions in the chat box. With this, I would like to go to introduce our speakers for tonight, and I'm very happy to do that. So we have with us Dr. Rahman. He's the Chief of Psychiatry at Children's Hospital Alberta, and he's also Chief and he's also Associate Professor, Faculty of Medicine in University of Calgary. Along with Dr. Abdul Rahman, we have Dr. Sakina Raj, who is a famous family physician, and she's Associate Professor in University of Calgary. Welcome you both.
Thank you, Samina.
You're welcome. So without wasting much time, I would like to hand over to our respected speakers, and we will open our topic, which is mental health issues related to COVID-19. So Dr. Abdul Rahman and Dr. Raj, would you like to share your thought on today's topic, which is like extremely important, and I think everyone is interested to know about it.
Thank you very much, Dr. Samina. I think one of the important things that we know that our community is facing an unprecedented challenge and has been, going through this for quite some time now, since March. And we have been affected significantly. And particularly since September, there have been many restrictions that have come, and that has really limited the social, academic, work life for people. And this has really created a number of different issues. Even just a recent report from, Nature. Nature is a very well-renowned journal. There was a published report from February this year, 2021, which actually has talked about the anxiety and depression going from 11% in populations, different parts of the world, to 42%. That's about 4 times increase in number, which really is something I was not expecting that will go to that level. Fortunately, I think we don't have that much an issue in Canada and Alberta, but clearly we are seeing unprecedented times with regard to stress, and
Mm-hmm.
that's a big problem. One of the things that we have seen is that uh, the number of people coming with mental health issues to hospital has gone up. I was just looking at the numbers that we can compare from previous 4 months from a year ago to recent. The increase in number of emergency visits has gone up by 150%, which really is a huge number, and that is something that we should be concerned about. As we had rightly predicted, the tsunami of the COVID is there, but the tsunami in mental health is starting, and it's probably going to stay beyond the time when COVID will be under control. So we need to start thinking about that and start preparing about that, and we need to reach out to our people to help them understand, what may be the issues that are causing this, what are the different resources that are available, and what can we do for ourselves to begin with, for our
Mm-hmm.
families and for our community, so that we can deal with it.
Okay. Dr. Abdul Rahman, before proceeding further, I'm receiving the message that I think we are not live on Facebook. So if we can do that,
Okay.
I, do you want me to stop sharing my screen so you can share your screen?
No, that's. I think probably that should work still, but if you unshare, then I will
Okay.
make sure that that is done.
Mm-hmm.
Okay. Let's see if you can unshare your screen so we can.
Yeah, I stopped sharing my screen and let's see, we'll get a message if we get live on this Facebook.
I think there's a problem with connecting. It is showing at my end that it's going through, uh,
Mm-hmm.
but it looks like it's not. And on
Yeah,
my Zoom, it also shows, oh, it was showing that we were live. Okay, I'll try again. You can carry on and I will keep working.
okay. So meanwhile, I'll move to Dr. Sakina Raj. And Dr. Raj, your thoughts on mental health issues related to COVID-19, especially because you are the entry point for the patients.
Yes, thank you, Samina. Yeah, definitely, as Dr. Abdul Rahman already suggested, I'm not going to repeat what he said, but that's true. COVID-19 has negative impact on Canadians' mental health. Stress levels are doubled since the onset of pandemic. And some data from CAMH, this is policy advice paper.
Mhm.
All my citations, references, and resources were given to you, so it will be shared either on MDI webpage or if anybody interested can ask for it. Uh, so this paper, CAMH Mental Health in Canada, COVID-19 and Beyond. 50% Canadian reported worsening mental health. 81 reported pandemic is negatively impacting their mental health. Substance use has increased and increased alcohol consumption, almost 21 to 25%, different age groups.
Wow.
Sleeping issues, PTSD, depression, anxiety. And I tell my people, especially patients, friends who discuss about the stress, that it is normal to feel during this pandemic being sad, distressed, worried, confused, scared, and angry. But if it goes beyond our control and we show the signs of it's affecting our mental, physical health, then it become a mental health issues. So it's quite okay to have those emotions because it's pandemic. But
Mhm.
and then Samina, as I spoke with you earlier, I'll be talking about new stressors that mental health illnesses are caused by this pandemic. Healthcare workers like myself, my colleagues, and other healthcare workers are going through
Mhm.
simple ways to reduce the stress And at the end, we'll try some mindfulness practices. I'll just talk a few more lines before I give it back to you. Recent New England Journal article by Pfeiffer, Bain et al. The citations will be again in MDI post. Major stressors at present are because of uncertain prognosis. We don't know where the disease will lead, right? And what is long-term effects on our body. Shortages of resources for testing and treatments. Protection, especially healthcare providers, we are scared, right? Imposition of unfamiliar public health measures. That's why anti-mask rallies and all those going on these can fringe on personal freedom, which can make you very angry and frustrated. Large and growing financial losses, conflicting messages from authorities about COVID cases and COVID vaccines, and every day we hear something new and different. Even vaccine questions are distressing people. When we'll get it? What will get it? What are the side effects? Should I get it or not? Those. And our stress is tremendously increased because of the virtual care and home workings, financial stress, extra work. Frontline workers are exhausted, doing extra shifts, and patients are venting on doctors, healthcare workers. So whole situation is really creating lots of mental health issues in us, in general public, family and friends.
It seems like everyone is going through a lot, and that's being a year full of a lot of stress and new stressors. So I'll get back to Dr. Abdul Rahman. Were you able to sort out the Facebook issue, sir?
No, it's not connecting. So we'll have to post it after. I'm recording it, so we should be able to do that later.
Okay, so we'll do that. So as both you and Dr. Raj mentioned about a lot of stressors that everyone is going through, what are some methods and some ideas that we incorporate into our daily life to, prevent these stressors or to make our mental health better?
So if it's okay, Dr. Sakina, maybe I can start and then I'll hand it over to you. But there are a number of things that we can do actually. Maybe this is the time that we can go back and reflect and be with ourselves, with our family. I mean, there is always that aspect that as humans we have been running, and we have developed this lifestyle that really has taken us away from our families and sometimes away from spirituality and being with ourselves and understanding. So one of the things that we can do is to look at our own health, find time for yourself, basically, develop some schedule. You can make sure you're sleeping well, you're sure you are healthy and eating well, make sure you have a schedule for physical activity so that you can decompress yourself, because that's when what you really need at this time. And sometimes it really we just deal with stress all the time, so that piece is important. And one of the things that we can certainly do is to have that schedule so that we can get that done. Because as you know, that example about the traveling in the airline, and if there's a low pressure and there's low oxygen in the aeroplane, they tell you to basically put your own mask first and then to give mask to every other people. So that's important. The second part is the close proximity to you are your family members, so make sure that you're connecting with them. And like you, everybody is going through stress. I think that is very important that you respond to that and look after your family members, look after what their needs are, talk to them, be creative. Start some activities that are healthy, that will involve people, that will involve conversation. And those who don't live in your house, make sure you reach out to them and connect with them. Make a phone call. You don't have to physically go there. I know there is a limitation of visits to other people, but you can always make a phone call. I mean, we are all sick and tired of Zoom, so maybe you don't need to do that. But at least picking a phone and talking to them is important. The other piece is about the community that we need to think about. If you are able to afford to reach out to people to support them and to provide them with any help, there are a lot of charity works going on, making sure that you reach out and you make a contribution. And if you can't do that, at least what you can do is to you know um, support other ways that you can. For example, if you are, and I'm not against any business, so don't get me wrong, but the people next door to you, the corner shops that you have, the small places that you have around the corner, the restaurant that you had, close to your house, the chai khana or the tea place that where you used to go, they are totally dependent on you. They're not going to go anywhere else and ship their stuff to some other country or some other place. So it's our responsibility to reach out to them, make sure that we are, making a contribution, because their health, financial, physical, social, emotional, is also very important. So we as a community need to look after each other in many ways, and that really will help. In turn, somebody else will be looking after us. So that connectivity is very important. That just is not limited to Zoom or being physically there, but there are many other ways to do that.
Mhm. These are very good suggestions, Dr. Abdurrahman. And as you were talking about the community, and there was a question about that as well, and I also want to talk about it. Dr. Raj, what about the healthcare professional? They have been the frontliner for the last whole year, fighting at the front end, and they have family. What kind of stress they are going through, and do they have the right support in place?
Yeah, very good question. Let's see what Dr. Abdul Rahman left. I will pick it up. Healthcare workers, the first and foremost, which I see is they're facing lots of stress, as I said already, working extra hours and PPEs and always worrying about, and sometimes they have to isolate if they are exposed, all those. Plus, they are facing lots of discrimination from the people, as people are scared that they can spread coronavirus. They're even afraid to come to clinic to come for their checkups. They think that we can give them coronavirus because we see other patients. So it's very important that we do not discriminate people who have coronavirus or healthcare workers. Balancing between work and personal life are becoming challenging for them.
Mhm.
According to CDC, I was reading, providing care to others during the COVID pandemic can lead to stress, anxiety, fear, and other strong emotions in healthcare workers. And we have to recognize the stress. And I'm telling about myself, my colleagues, and all healthcare workers. If you are experiencing feeling very irritable, like irritation has increased, anger, getting nervous, anxious, helpless, lacking motivation, tired and burnout, sad or depressed, sleep issues, or decreased concentration, then it's called compassion fatigue, and you have to take help. Now, a lot of help is available for the doctors, and we have posted Alberta Health site websites for healthcare workers. Also, they have 1-800 number I have posted, and AMA has it. Uh, there is a special service looking in counseling in both the hospitals. They can get to, or
Mhm.
go to the family doctor, connect to other family friends, and get help. So these are the important stressors healthcare workers are facing.
Mhm. And I'm glad that there are some support in place, as you mentioned, and we will be sharing those because, as Dr. Abdul Rahman mentioned earlier, that in airline there is a shortage of oxygen. They always ask you to put your mask first before anyone else. So we need to make sure that our healthcare workers are safe in order to provide our community. This brings me to another very important group. We cannot ignore that. We talk about the adults in the community. We talked about the healthcare professionals. Dr. Abdul Rahman, how about children? How this pandemic is affecting the children?
Well, it's certainly affecting them in a big way. But I would generally say that there are um, different impacts on different age groups and the nature of their temperament of those children. For example, kids, particularly younger ones who have anxiety and who really don't want to go to school anyway, they're happy being at home and around parents. So they are affected in a different way because obviously they are at home and they're not going to school. But also, if they, I know that some of this has been lifted and some of these kids are going to school, which is great. But those who are still at home, they're actually affected in a very different way. So they're actually okay now, but the problem will come later when they actually have to go to school. So, as you
Mhm.
know, anxiety kind of there's some way that you want to avoid social situations of being in public places, but once you are exposed to it in a big way, it will create a problem. So, in coming days, you will see a lot more, perhaps school avoidance and those kinds of things. And then there are other people, particularly worse affected are the age groups 13 to 18, and because they're the ones who wanted more independence. They're the
Mhm.
ones who are, want to socialize. They want to see their friend. They want to get out, and their life has changed tremendously. And if they are cooped up in their house, it creates a lot of stress. So there's a stress for themselves, but also stress for the family because bringing these, some of these family members together, for such a long time creates a different kind of a pressure within the family. And not only just these young people, but also parents. So that creates another
Mhm.
pressure point on the parents. But, interestingly, uh, these people, there, I would say, within that group, there are three kinds of different issues. One is those who are going through stress and they are cranky and irritable. They think life sucks and why are we here and all that kind of stuff. But they are not really having mental illness per se, because there's a lot of normal stress that has gone up for everybody and everybody's dealing with it. But that doesn't mean that you are having an illness. You still have to deal with stress and find ways of dealing with the stress. And Dr. Sakina is going to help us learn some meditation techniques later on. And she's been doing that work, I know, for the community. So, that is, there can be other things that you can do to decompress. The second type is those who have had mental illnesses from before. They had anxiety, they had depression, and other illnesses, and they haven't been able to see their therapist in the way they used to see, or they have not been able to go for one-to-one interaction. And Zoom is helpful, but it's not the 100% replacement of face-to-face meetings. And some of them are falling through the cracks completely because they're not making that connection, and others we are seeing that they are having still struggles with that. The third category of patients that we are seeing, and then that's another category that we are seeing. When I say there's been a 150% increase in number of young people showing up in hospital,
Mhm.
many of these are new, which really is a concern because these are not those who had previous mental health issues. These are new, age group 13 to 18, and they are the ones who are now completely lost and they're struggling because they don't have the already connected resources and they
Mhm.
need to be connected to new resources which are not as abundant as these were before, and they're going through the problems. So there has been an increase in all those issues: anxiety, depression, stress, and many other things. There has been increase in substance abuse in adults, and there has been in the teenagers when they get out. You don't know
Mhm.
where they are and what they're doing. The supervision is going to be harder. So all those factors are really affecting young people in a big way. And the last piece that is not a mental health issue as such, but is a critical part of young life is learning, because
Mhm.
that is also being affected in a big way. And
Yeah.
we will have to wait to see what the outcome from that is in the coming, months and years.
Mhm. This brought me to the question which was asked in by some of the members. How parents can identify anxiety and depression in children, like the children who were not diagnosed previously. Are there any like symptoms that we should look after for? Like, how can we identify those?
Well, I mean, it's difficult in those young people who are limiting themselves to their rooms now, and
Mm-hmm.
because you don't see them, and when you see them, you have little interaction and all that. But there's also an opportunity to, as I said earlier, if you're doing things as a family, it's easier to pick up a change. So for
Mm-hmm.
anxiety, quite often, these children or young people may be able to tell you about
Mm-hmm.
those things, but sometimes they don't tell you. You have to figure it out. So if you feel that they are uh, excessively worried about doing things or not going, or they're having nightmares and they're for no reason they're having the sleep issues, those kinds of
Mm-hmm.
things. But if they share with you, they will tell you that they are worried, they're stressed out about their family dying, they're stressed about their family members dying, because that's another issue. Uh,
Yeah.
we are not able to, do the rituals, social rituals that we usually do when somebody is sick. Somebody from our
Mm-hmm.
family dies. We go there, we hug people, we mourn, we do all kinds of things, but we are not able to do that. And
Mm-hmm.
for our friends and dear ones, so they hear all that on the newspapers, and exposure to some of that television channel causes a lot more stress, because
Mm-hmm.
all you're doing is listening to all that thing, all that hype of COVID.
Yeah.
So they will tell you about depression. You will see that you may see them isolating. You may see that they are not laughing as much. You may see
Mm-hmm.
that they're not doing things that they were doing. They have the thing that they really enjoyed before are not enjoying anymore. They're not sleeping. They seem unrested. They look tired all the time, and some of
Mm-hmm.
them may have active suicidal ideation. So it's not one symptom that will make up depression. It's a combination of all different things. Sleep and appetite will go down. They're losing weight, loss of interest. They're not able to enjoy what they call anhedonia, not able to enjoy things that normally people would enjoy. All those things coming together, not for an hour or 2 hours or half a day, and
Mm-hmm.
then goes away. It stays for days together and weeks together. That group of symptoms staying for a significant period of time, that will comprise depression. So you will then begin to think about, what do you do with these children? And I think the key thing is going back to that connection with the family is very important. If you don't know, if you don't talk to them, if you're not seeing them every day, if you're not having them on the dinner table, if you're not
Mm-hmm.
having family conversation, you have a problem already in place, because you will not pick up, and isolation will cause more problems.
Mm-hmm. And that makes sense because there is a lot of isolation, not only like socially, even within the house, especially with the screen time and all those. Dr. Raj, so if like once they identify like a strange behavior in the children, where should they go? Is this the family physician where they should take their children to? Like, what is the best way of like getting started?
Yes, Samina, what happens is when the parents notice or other family members, you have to do it multi multifactorial way. One is that, of course, you'll bring notice to your family physician. Either you call them, they are doing virtual calls, or you take them in person. or their pediatrician. That's one thing. But second thing, as Dr. Rahman said, you have to fold them in your family circle. So you have to involve them. For example, I tell small things you do with the kids. So if you're working from home or work, you have to take out time and gather them, take them outdoor activities, indoor, or just have fun with them in the house, involve them in the, say, for cooking or baking or drawings, or people are doing a lot of games, and sometimes they are doing these house parties and all, which are done internationally. Like we play with our son in Vancouver and my daughter in cousins in India. So those kind of activities. So you have to make them involved and make them loved. And sometimes you have to talk with them. And third thing is, if you have a spirituality connection, you have to connect them there also. So all these things, and school, to talk with their teachers, their school counselors. So if you have to do multifactorial, if they're adolescents, if they go into this behavior, there's danger of going towards drugs or pot. Pot is available. They think pot is very good idea to bring our anxiety down. So to actually take help from all of them and change your lifestyle to bring the kids back to normal or where they were.
So definitely the stress that we all are facing during this COVID era is real. But I'm glad that what I'm hearing, that there is a lot of support available. And I think this is something that everyone in the community would also like to know. And thank you, Dr. Raj, for sharing all the resources with me as well. I will be sharing on the MTI group, Facebook page group, and everyone can get benefited from there. I also understand that you're going to do a short guided mediation kind of thing. So what is it? Tell us about it.
Okay, so I wanted to talk about meditation, but before I wanted to talk to you about a little bit of new diagnosis which is happening. So maybe it will be your next question. Let us talk about a little bit of meditation theory, and then when your question finishes, we'll just finish off with meditation. Now, meditation and mindfulness are practices that can support all of us, healthcare workers, patients, caregivers, public in crisis. Especially it is an evidence-based, mindfulness-based stress reduction. We all know about MBSR, and there's lots of published peer-reviewed publications on it, and even randomized controlled trials are available. It improves anxiety, depression, pain scores, and it causes structural and functional brain changes. Have been demonstrated in the brains of people with long-term traditional meditation practices. And then what is meditation? It's simple thing, coming to awareness of the present moment. So what happens is when we sit, when we are praying, when we are doing anything, even we are taking bath, our mind is having 1,000 thoughts. I'll do the bath, hot bath, you don't are not present. I'll finish this and go and do cooking. I'll give this kids to this. I'll go to work. I'll do this, that. So thousands of thoughts. So you have to kind of calm down your thoughts and just be aware of the present moment. That's meditation. So I'll take, there are lots of different kinds. It's all one webinar in itself. So I'll not go in much detail, but when we are doing it, we'll work on it. Two terminologies we use a lot these days, MSBR, that is mindfulness-based stress reduction, and MSB, which is mindfulness-based cognitive therapy, which is scientifically proven and it's used and it's evidence-based practices. So we allow thoughts to come and go without attachments.
We lost your voice, Dr. Raj. Dr. Raj, we lost your voice.
I think the connection is a little bit unstable.
Yeah.
Are you okay now?
Yeah, we are okay now.
Your internet connection is unstable.
Joys of
Okay.
one more stress to face during.
I know. Can you hear me now?
Yes.
Yeah, you're good. Yeah.
Okay. So I was saying that it is evidence-based and scientifically proven. And at the end, I'll tell you about 3 or 4 times of small, short meditations, and we can do together.
This is very interesting. In fact, when you were explaining, I thought this is something which I need, because my brain is also that kind of brain which has multiple tabs open at the same time. So I need to close those tabs and present moment. So I'm looking forward to it, Dr. Raj. Dr. Rahman, what do you say? Shall we take some questions from the audience?
I think that's a good idea. So just before that, I think checking with Dr. Sakina, um, how long do you think that this meditation will be, so we can
See, I can do half an hour, 1 hour, 10 minutes, 12 minutes is your choice. But
okay.
Dr. Rahman, I did wanted to talk about the new illness, which we haven't come to the topic, and I promised the audience. That is called Zoom fatigue.
Oh.
So when I was reading about it, I didn't know there is so many published papers on that. And it's kind of emerging like a new symptom or new illness. It described the tiredness, worries, burnout associated with overusing virtual platforms and communications. It's widely prevalent, intense, and completely new. More than 300 million daily participants of Zoom worldwide.
Wow.
So according to the Stanford study, you might have come across from Professor Jeremy Billson, excessive amount of eye contacts we do on Zoom, and then seeing yourself on the video all the time, and especially if you keep full, can also cause fatigue and decrease mobility. Of course, you sit. Zoom meetings, virtual care, kitchen table, home offices seems here to stay, and it can be very exhausting. It has created whole new class of mental health and physical stressors that affects well-being and also work productivity, and can make you feel stressed, tight, and fatigued. Can you are you still hearing me?
Yes, we are. And actually, I'm
So
thinking that, yeah.
I will let you know few things they are telling how you can get reduce the Zoom fatigue is minimize face sizes on the Zoom, take breaks, pace and doodling. That means you stay away a little bit. Sometimes you hide your face and then become non-verbal. Rest, move. So move either in the chair or stay away from the grid. So you can doodle, or you take break and take a walk. And few of the things they had mentioned. And last thing is, 3 words I use for my patients and myself and others is ground, rest, and reset, with accessible short breaths and body-based meditations.
Wow. A couple of things, if I can add, Dr. Raj, this was fantastic. There is a data from, actually recent data from Stress Canada, that the number of physicians having stress and anxiety as a result of COVID and what is going on around is actually 70%. So 7 out of 10 really go through that. So I think it's a big number. And Dr. Samina, with regard to multiple tabs being open in the brain, as you know, I also work with the complex ADHD treatment team. So one of the symptoms of ADHD is that you've got too many things going on.
Oh my God.
So just so that you know, but I think this is important, that Zoom thing. Everybody's going through that, but physicians who already had long hours, are on it. And I sometimes my kids call me Mr. Zoom because I'm on Zoom all the time. So it's really a problem, because that is called giving you excessive sensory stimulation, as Dr. Sakina pointed out. So it's important to have a break.
It is. And after this session, I think I need to diagnose myself with certain certain illness might be. And there is one of the comment by Dr. Sarah. She's saying she's happy that the audience video is turned off, so they are having the well-deserved break from Zoom. Okay, so we have like around 20 minutes. So would you like to go ahead with the meditation session, or we can take one or two questions from the audience?
Yeah, I think we can take one or two questions and then we'll do it. Uh, what I will say, well, the remedies, Dr. Rahman already pointed out the whole list of what you can do different. So what you might have missed is uh, now healthcare workers are also working from home. And as he said, what I have done is like I am got crazy with phone consults and then in person. So we have to reduce our workload and we have to really make a schedule. So I work like 2 days only phone consults, 2 days in person, no phone consults, no Zoom. And you must have noticed no meetings for me. Give me the work, but I need to balance my life, my home, and my work. Otherwise, I'll go crazy. And it is not me only, it's for everybody. So, for the kids, Dr. Abdul Rahman did mention, but they are having lots of problem with increased screen times, increased video games, and social medias. So, social media is very important to keep us connected, but it's very exhaustive too. So you have to really cut down your time. Not every time a notice come and I go on my phone. Even I am doing it. So what can I tell to others? So we have to really cut down and limit our social media context too. And of course, we have to connect with family, friends on right way, but not on like TikTok. And also, they are saying that support healthcare workers. And I already said no discriminations, both with the patients and with the, and MDI is doing a good thing. We are providing all the care they need and also the free food for our coronavirus patients and keeping them, we call them also, keep their morals high. So we should do here nationally, even internationally back home. People need our moral support.
I think you raised very good, an important point, Dr. Sakina. Children spend more time, so it's really a tricky situation. You know, if you don't give them the ability to connect with people through whatever these mechanisms are, phone or video chat or whatever, then they're some of them are totally cut off from the world around. But there's also a positive side to it, if I can share that with you. Um, I since I've started COVID assessments with either new assessments or meeting new people or meeting as a follow up, I have I have met almost every kid's dogs and cats and everything else that I always heard about but never met them, and they're really, many of them are actually more open with having a conversation with me because they have their cat beside them or in their lap or they have a dog with them, and they kind of get comforted by that somehow. So there is a strange, positive side to that, that many of these children are able to connect better with you because they're in a more safe, sort of less stressful environment, and they have their pets with them, which really help them to speak. I think that's an element I had not thought about before getting to Zoom thing, but I'm seeing those benefits, that really come handy all the time.
That's true. So,
Mm-hmm.
Dr. Rahman, Dr. Samina, I think we have 15 minutes left. So just let's try some meditation practices. And what we'll do with the question is we'll keep on Facebook and in our coming web series, we will try to cover them. So people are encouraged to ask questions either here or at our Facebook page. And we have lots of good speakers coming. They'll cover it up.
Yeah.
But I
There
don't think anybody is going to do meditation, so let's practice some breathing and some meditation.
Okay, go ahead. Yes, because we have some questions. We'll take note of those questions. I think we have some Milan Mathu who is raising hand, and we have some question in Q&A box. So please write down your question. We'll take note of it, and we will cover in the upcoming sessions. Over to you, Dr. Raj.
Okay, so should Dr. Abdul Rahman do some closing remarks?
Sure.
Well, again, I do want to answer at least one question which I accidentally read. So that is from Kevin about the inpatient people coming into the unit were positive. So Kevin, I think you may already know this, but those who don't know this, we actually have a COVID positive unit for children, and not children, but adolescents, and that is based in South Health campus. So anybody who is positive, and we know that that person is positive with COVID and still need mental health service, we actually transfer that particular patient to South Health, where they are then kept in that particular unit, and staff is trained, and they cohort those patients there. So your fear about them getting other people infected who are not infected with COVID is a good fear or worry, but we do have a plan for that. So over to you, Dr. Sakina, but I know that you will probably continue to the end, so I want to thank everybody who has joined this session, either via Zoom or via Facebook. Some of you will be able to see this on YouTube as well. These will be open for a short period of time, maybe for a month or so, and then we'll have to take them down because we can't keep them forever. And so, feel free to watch on YouTube, MDI YouTube channel or Facebook, and these will be there. So thank you for joining. And my apologies, we were not able to go live for first 10-15 minutes, but we have been live since then. So hopefully you will have captured most of it. So thank you, and over to Dr. Sakina. She will take us to the end.
Yeah, I'm afraid, Dr. Abdul Rahman, you might be sleeping after my session. So thank you for thanking us all. Okay, Samina.
Yeah.
So as I said, meditation is coming to awareness of the present moment. We all are, and I know Dr. Abdul Rahman too, and all my colleagues who have joined, we are tired from today's work. And usually I do this at the end of my praying sessions, always. And as I said, it's very simple. It's not that big techniques or something, and everybody can do it in every moment present. So let us do 4 types. One, we'll do the mindfulness of breathing. So I'll teach you the right kind of breathing and kind of how you can become aware of the breathing. And that breath is as an anchor to the present moment. So when you concentrate or meditate on your breathing, you can really anchor the present moment and really can block off your thoughts. Then you do compassion focused meditation. Then we'll do a little bit of body scan, being aware of each part of the body as an anchor where we hold the tension. And in the last, we'll do the walking meditation. We'll focus in our feet in contact with the earth and surroundings. And then we'll finish the session, or maybe we are half asleep. So all of you,
sounds good.
See where I'm sitting this is my yoga room, and basically all the yoga postures are in the back. And Milan Mathur, you mentioned, is one of our teachers. She's
okay.
And, she must be tired because we do every day.
Oh, I think the connection is unstable again.
You're mute, Dr. Raj. We can't hear you.
I think our connection is unstable.
Okay. Is it okay now?
Yeah.
It is. It is.
Okay. My connection is unstable. I don't know. It's because I'm in basement or something like that.
The internet is tired as well.
Okay. So Samina, I'm starting, but if my voice goes away, please give me heads up. So all of you, either you sit in the chair, or if you have a quiet room, you can put a blanket on you and a pillow and lie down, or sit against the wall and just relax and just follow my instructions and forget where you are, what you are. Ready?
Mm-hmm.
You can close your eyes and just listen to me. So when we are breathing, if you have seen the children breathing, or especially the infants, they breathe from their tummy. So when they breathe in, their tummy comes out, and they breathe out, tummy goes in. Now, as we grow up in adult with tensions, we have forgotten how to breathe right. So we breathe shallow breathing from our chest. When we breathe out, our stomach is doing opposite. It goes out. So you have to really feel it that when you breathe out, your stomach should go in. So do 3 deep breathing. Take a deep breath in, stomach comes out. Take a deep breath out, stomach comes in. Do one more. Breathe in, and your nose to navel, and you breathe out, your tummy goes in. So you have to practice when you are driving everywhere. So you breathe right. Now, let us do some anchor, breathe as anchor for meditation. So just close your eyes and breathe and feel the breath goes through till your feet. Now, how can you breathe through your feet? So take your deep breath and let it go till your feet and bring out and take out the whole breath from the feet till your nose. Do one more time. So when you are praying, especially when you're standing, you do this. So you'll never have different thoughts. Breathe in till your feet and breathe out from your feet till back. Then this is Milanji's practice too. You breathe circular. So you breathe in from the back of your spine to your tummy and breathe out from the front, from your nose. Breathe in through your spine, breathe out from your spine. Then one thing you do is, suppose you are having pain in your neck, which I'm having, or hands, or your feet, you breathe in your pain. So suppose that you're having pain in the neck or neck is stiff, breathe in your neck. Let the breath go in your shoulders, which are tired and tense, and breathe out and relax the shoulder and neck. Do one more time and relax your. So whenever you are having pain, relax that tension muscles with your breathing. And if you do right and quiet place, you can alleviate the pain to most of the extent. I have not taken Advil for last 1 or 2 years, touch wood, because I heal myself with hot water, stretches, and breathing. Now we'll do a little bit of body scan. So if you are lying down or closing your eyes, just follow my instructions and scan your body. So all your thoughts, let the thoughts come, but do not take any action on the thoughts. And you feel all your focus on your forehead in the center. So breathe and focus on your forehead in the center. Breathe out, relax your forehead completely. No, there should be no wrinkles on the forehead. Then focus on your face, the whole face, and relax your face completely. Put a smile on your face and breathe. Now bring your attention to your shoulders. Make them very tight shoulders, and then let it go with your breathing. Relax your shoulders. Your shoulders are completely relaxed. Take a deep breath in and out in your shoulders and let your shoulders go numb. Then look at your elbows. Focus. Breathe on your elbows and let it go. Relax completely on your side, either sitting or sleeping. Then tighten your fist tight, 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 and release them and breathe and just relax your hand and all your joints. Now look at your chest, and your chest is so tight. You have to release all the tension from your chest. Breathe in and just breathe out, and with ha, release all your tension from your chest. Look at your tummy and navel. Concentrate, hold your concentration on your tummy. Make it tight and just let it go with your breathing. Relax your tummy. Now concentrate on your knees. Make them tight and release. And again, concentrate on your knees and all your pain going away with your breathing. Then come to your ankles. Your ankles are so tight and feet are hurting. Make them tight, full tight feet and ankle, and release. And just concentrate on your ankle and feet and let them go. Now let us try to walk in a forest today, and we will do a 5-6 minutes walk. So see, we are walking from our busiest place in our backyard, and then see that forest, or think about Adhd Park Forest. So between two rows of trees, you want to walk alone. And when you start walking, there is a dried leaves under your feet. You feel your feet on the leaves and they are crunching. Hear the voice of leaves crunching. And there is a soft breeze. Can you feel it on your face and body? And your hairs are flowing in this soft breeze. You walk further and you see all the green leaves, and some of the trees are flowering. See the colors of the flowers. In Alberta, you can get these white and pink and red flowers on the trees. And we are not in winter, we are in a nice spring weather. Come on, walk. Can you smell the sweet smell of forest? It's like damp earth. Take a deep breath in and relax your tensions. Walk further, little faster speed, and you can walk for 4 or 5 minutes with breathing. And what you see in front of you is a nice waterfall. Can you hear the voice of nice waterfall flowing and gurgling water? And then the small spring which is flowing from that waterfall. Walk beside that. So when you're walking beside the spring, you feel the wind crashing on the stones. Can you hear that? Wow, there is a bird song. Hear the bird singing, and such a nice melodious voice. It makes a smile on your face. And then you walk further, see more flowers and some wild Alberta roses. But what a smell, what a nice fragrance of rose. Take deep inside you and walk on the pebbles now, because you are on the water bed walking, and your feet is little hurting with the pebbles, but you feel a little water on it too. You feel good about it. Keep walking. Oh, you find a nice grass ground. You want to lie down on the soft grass. Just lie down with your hands and feet completely touching the grass. Grass is like velvet under you, very green with fragrance. And you look up and you see birds flying over you and some nice clouds. Look at those and you want to fly. So let your body go, and you are flying up and you're flying in the sky, and you are completely tension free, no stress, no headaches, nothing, no work, just you're flying with the birds, and you want to just relax. Then you come back slowly on your grass. You feel the velvet under you. You don't want to go home, but I think it's time that we walk back. So you go get up slowly Oh, you see butterflies, and they are such a beautiful colors. Just watch them from flower to flower. And you see mountains. Maybe you are in Canmore, who knows, or Kananaskis. So those beautiful peaked, snow-peaked, maybe Three Sisters or Mount MacDonald or Lady MacDonald, if you have seen those mountains. Just keep walking back in the forest and your feet touching the ground, crunching the leaves, and slowly you come out of the forest and so much relaxed. So now you take a deep breath in and out, and then you rub your hands. Don't open your eyes, rub your hands many times so you create a lot of positive warm energy. Put on your eyes and relax your eyes. Let all the big stress and fatigue of your eyes go away. Do 3 times rubbing of hands, putting on your eyes, and then open your eyes slowly and pray for other people and for yourself. And I think it's 8 o'clock, so we'll finish our small meditation tour. Thank you very much, everyone.
Oh, wow. It was so hard to wake up, Dr. Raj. I was about to sleep. This was very helpful. I'm just wondering, are there resources available to do this at home as well?
Yes, you can. There is lots available on YouTube. You write down 5 minutes guided meditation, whatever faith you are in. There is Sufi, there is a Hindu, there is a Muslim meditation.
Wow.
Very simple, and we do after our yoga class every day, different kinds. And our one of our teacher is with us. Other 3 teachers are there. So anybody interested to join, you can call us, and we will. It's free, but only payment is your commitment. So if you don't come 4 or 5 days a week, they will kick you out.
Thank you very much. It was very helpful, and I'm definitely going to try it because you mentioned you're Advil free for 2 years, and I'm someone who take Tylenol as candy, so I'm definitely going to try this. With this, we will conclude our today's session. Thank you very much, Dr. Raj and Dr. Abdul Rahman. I'm sure it was extremely helpful and informative session, and time just quickly passed by. We do have some question, and I encourage everyone to keep writing your questions on the Facebook. You have an email given on the poster. So send your question to that email. We have more sessions coming up every week. So we will address your question in those sessions. Thank you very much, everyone.
Thank you.
Good night.
Okay, good night.
Good night.
Just before we part, there's one thing I just should mention, that human physiology does not have any religion. So I think this is nature, and that we need to make sure that we are connecting with nature again, whether that is meditation or slowing down or whatever method works for you. I think that's what we should try to do.
And also don't forget your water. So hydration, hydration, hydration.
Absolutely.
Absolutely.
Symbolic. Thank you very much.
Thank you very much, everyone, for your support. Take care.
Thanks.